Let's turn to coronavirus. Another variant of coronavirus is gaining ground. Health experts say it's more contagious than the other Omicron variants.
Yeah, scientists say the variant, which is called BA.2.75, may be able to spread rapidly and get around immunity from vaccines and previous infections as well. So joining us now to discuss this a little further is Dr. Hannah Barbian. She's a virologist at Rush University Medical Center. Dr. Barbian, thank you for being here.
Sure.
Okay, so what is the most important message you want to get out to viewers with this most recent variant?
Right. So evolution is a very natural part of virus biology. So we expect that there's going to continue to be new variants that arise. That's just what variants do. BA.2.75 is a really new virus. It's one that was only recently discovered, and there's actually very few cases in the US right now, only a handful, maybe 5 or so.
So basically, if you've been vaccinated or you've had COVID before, you're more likely to get this variant, subvariant, than you were some of the earlier ones?
Right. So some of the newer Omicron variants, including BA.2.75 and BA.5, which is the current predominant variant in the US, they're able to evade immunity from previous infections, which means even if you've had a somewhat recent Omicron infection, you could be reinfected with Omicron.
What kind of outcomes are we seeing so far? You mentioned there's just a small handful of cases so far, but are these variants leading to as severe outcomes as some of the earlier variants?
Well, it's really too soon to tell. Again, there's only been a small number of cases for BA.2.75, but it seems in general that with Omicron, we're not seeing the sort of high hospitalization rates that we had seen in the pre-vaccine era, and that's because vaccines still strongly protect against hospitalization with any new variant that we've seen so far.
But as you know, and other health officials know, that you might hear a lot of people saying, oh, why should I even get the vaccine if it's not going to keep me from getting this virus? What do you say to them?
Right. So even if you still get infected, if you're vaccinated, you'll have a more mild infection. You'll be prevented from having some of the severe outcomes that could not only cause a problem for you, but could burden our local hospitals. So really getting vaccinated and getting boosted is the most important thing that you can do right now.
All right, very well stated. Dr. Hannah Barbian from Rush University Medical Center. Thank you for your time.
Thank you.